On this other half of the program, WATHI West Africa think tank released a report in February 2020 called Mataki on the functioning of the health systems in West Africa after COVID-19. On this edition of the program, Advocacy Officer at the WATI, Dan Vieira da Costa, will tell us more about the third recommendation and the findings of the report. Thank you, Dan, for joining us. WATI released in February 2020 a report that you called Mataki on the functioning of the health system in West Africa. Tell us more about the main findings of this report.
WATI published in February 2020 a report that you called Mataki on the functioning of the health systems. That is kind of a situation analysis of health systems in West Africa. Please tell us about the main findings of the report. Yes, thank you, Imo. As you said, the report was kind of a situation analysis on how are the health systems functioning in West Africa. What is the situation in the 15 countries of the West African region regarding prevention, regarding human resources, regarding financial resources, regarding the health structures, regarding the partnership between the countries in West Africa for improved health systems across the region. There are several findings that were highlighted, but also a series of 5 recommendations that were made to improve the functioning of the health systems. It's important to say that the report, was made based on not only a research work, but also on several interviews of health experts across the region made by our team, and then there were that compilation work between the findings of the several reports that we consulted, but also the findings of those interviews of the health expert. So the more striking findings of the report were that obviously there were the insufficiencies of the health systems in West Africa were kind of a concern for everybody way before the outbreak of the pandemic in early 2020. But the pandemic only highlighted those insufficiencies and those gaps in terms of investment, in terms of in terms of human resources, in terms of prevention, in terms of medical equipment, etc. We need. First of all, it's important to say that there were how can I say, there were progresses made in West Africa, in the region, in the health sector, because we need to have in mind that we are in a sector where we had previous health crises such as Ebola, but also some countries in West Africa are in conflict. So the context needs to be also analyzed here to better understand how the health systems are evolving in the region. But the indicators regarding the health situation in Africa in general, in the countries of WATI zone especially, show questionable and regular progress over the last 2 decades. The evolution differ from one country to another, of course, but the overall trend has been positive. The data clearly show that the health status indicators have improved largely due to a scale of international financial contributions dedicated to combating major pandemics, but also malaria, tuberculosis, HIV/AIDS, and some major donors such as Global Fund have played a key role in the countries of the region and have made it possible to considerably reduce the health expenditure of states and population. But on the other hand, also the states continue to make insufficient efforts to invest in the health of their population. The objective have been proclaimed many times of dedicating 50% of the budget, which we call the Abuja Declaration. The states have committed to dedicate 15% of their national budget to health systems, but we're seeing that they're facing some struggles in actually implementing that commitment. So, as I was saying, we can talk about that struggle in implementing that commitment of 15%, but also we can see that according to WHO, we see that there is the performance of the health systems in Africa, in West Africa, only reach 49% of what they should achieve or what they should reach. This is according to WHO, but also we see that there is kind of a delay in terms of how can I say, universal health coverage. We see that there are, very encouraging progresses that were made in some countries such as Ghana or Senegal or Mali, but still in overall, when you take the overall situation in West Africa, we see that there are struggles in ensuring that those that really need it, those that do not have the financial means to afford a good health, are left, outside the health systems because they just cannot afford benefiting from health coverage. But also we can talk about inequalities, as I was mentioning, an inequality in accessing the health care between the different countries of the region, but also between the different regions of the same country. We can see that the populations living in urban areas or in big cities of the country have easier access to healthcare, to health structures, to health professionals than those that live in rural areas or in very remote areas of a country, which shouldn't happen because all the inhabitants of the same country should have equal access to healthcare. But we can also talk about the lack of equipments, the lack of medicines, the lack of the very concerning state of the health structures in West Africa that are affected by a lack of hygiene, but also the health professionals, the training of the health professionals that not always fits or corresponds to the necessities in terms of health professionals. Like you can have a lot of health professionals in one specific specialty, but in another one you have very few health professionals available in the country. We can, talk about the fact that a lot of health professionals also are migrating from Africa or from West Africa to Europe to find better work conditions. All those are some very striking findings that we found or that we highlighted in this report.
Could you remind us of the 5 recommendations made by WATHI to improve the functioning of health systems in West Africa?
Yes, I mean, based on those findings, WATHI made a series of 5 recommendations based on the findings, but also on those recommendations were already expressed by the health professionals that we interviewed across the region. The first one is to put in place a preventive policy to combat diseases at the heart of the health system. So we understand that prevention is the first step to a very strong health systems, because the most people are informed about the preventive measures to adopt, about how to avoid being infected by this or another diseases. The more we can have a stronger health systems, and the more we can have we can reduce the incidence of some diseases in the population. In this recommendation we talk about, for example, a lot of awareness raising sessions to students at school, but also to teachers, to parents, to made available centers for prevention centers in communities, in remote communities. For example, this is what this recommendation is about. Then we talk about we recommend to ensure the training of sufficient human resources for health, including mental health, their equitable distribution throughout the national territories, and their effective supervision. Here we talk about investing in the training of health professionals, but also we talk about improving the working conditions or the career development prospects of medical staff to avoid recurrent strikes, maintain quality human resources in the public sector, and maintain a satisfactory level of motivation and commitment. We talk also about rethink the scholarship program, so to encourage training in medical and paramedical fields among young people from the most disadvantaged regions in each country, according to national health statistics. There is also sub-recommendations here under this recommendation of human resources, where we talk about, consider the training of non-medical health professionals, in particular nurses or midwives, in specialized schools selected by competitive examination to carry out certain relatively simple and routine medical procedures generally reserved to doctors alone, in order to make up for shortages program pragmatically and to care for patients in the short and medium terms. These are some sub-recommendations under this recommendations related to human resources. The third recommendation is to better fund the health systems in order to promote access to care and medicines. Here we talk about, once again, to see how to actually implement this commitment of the states to dedicate 15% of their budget to health systems in their country. But also we talk about allocating specific budgetary resources to the health and sectors by, for example, allocating to health sector resources derived from taxes on products such as tobacco, alcohol, luxury goods, some important financial transaction. We also talked about, drawing inspiration from Rwanda or Thailand, and other national systems or low or middle income countries that were successful in providing health coverage to the informal sector, as well as consider the creation of public health insurance programs for public sector employees or private sector employees, but also for the rest of the population simply. The fourth recommendation is to improve the day-to-day functioning of all health service delivery institutions. This is, for example, about when you go to a health structure and you see that the health structure, the health center is not very clean, or you don't really know where to pay or how much you need to pay or who do you have to pay to, when there is kind of a darkness about the payment because of corruption, for example, or something else is to something that we recommend to fight against this. It's, for example, to have a clear posters in the health centers where you see the prices of the treatments, where you need to pay them, or, for example, put in place some very regular audits, internal and external audits, to assess to simply assess the functioning of the health structure. We also recommend under this, this thematic of the functioning of the health structure to, for example, to promote the use of modern information and communications technologies in health institutions to increase the speed of processing and follow-up of patient records, to establish transparent payment systems, for example, and the last the recommendation made by WATI in the Mataki on health systems is to strengthen the national health systems through the development of research, the pooling of researches at the regional level, and the institutionalization of public debate on national health policies. Here we have we can see this recommendation at two levels. The first one is the national level, where we recommend to organize, for example, to organize periodic meetings between all institutions, departments, agencies, movements, foundations, institutions, to have a multi-sectorial debate on health, to consider all the sectors that can bring added value to this, to the discussions on how to improve the health systems. But also we can see at the regional level, we talk here about the West African Health Organization, which is the kind of the institution under the ECOWAS that is specialized on health issues, and we recommend to increase the coordination of national health policies, including for mental health, and the coordination of international research partnerships across West Africa, but even and also the mobilization of international financing. So these are some of the sub recommendations under this very last recommendation.
Now, today we would like to hear more about the third one on funding of health systems. What does WATI recommend for a sustainable funding of health systems?
Yes, so regarding this third recommendation, that is to put in place better funding systems, for health systems, and in order to promote access to care and medicines for all. We mentioned it several times. The very first step will be to really truly consider the investment in public, universal and free health systems as the very first priority of governments, together with education. So this starts with effectively achieving the objective of a 15% share of the national budget dedicated to health sector. That was really a commitment that the head of states made themselves in Abuja in 2001 in Abuja. So this would have been the very first step. Like 15% of a budget is a very consistent amount of funding that could go directly to health systems, and this will be, as I said, the very first step to improve the funding of the health systems in West Africa. Then we can think about allocating, as we mentioned, specific budgetary resources to health sector. For example, all the taxes that are coming from that are coming from tobacco, that are coming from alcohol, that are coming from the luxury goods, the very important financial transaction. All those taxes can go to strengthen the health systems funding. That will be a tremendous amount of money that could be used to improve the health systems of each ECOWAS country or even the African countries. Then we can talk about also, we can think about, negotiating with the support of the World Health Organization, a formula to ensure financial compensation for the health human resources that are trained in African countries and then recruited in high-income countries, providing resources to be used exclusively for the training of health personnel in the countries of origin. This would have been kind of a compensation because they were trained in Africa, in West Africa, and then they go to Europe, probably looking for better working conditions. But this could have been negotiating that kind of compensation, or how can I say, the financial compensation. This would also be another, funding source to improve the functioning of the health systems in West African countries. And the very last sub-recommendation that we mentioned under this, to better fund the health systems, is here to look at some countries such as Rwanda or Thailand, or even other countries in West Africa that were successful in finding a very sustainable way of ensuring a national health, universal health coverage to all the citizens in West Africa. To all the citizens in their country. They're very good examples, and it's just a matter of inspiring from those very good examples in West Africa, and obviously adapting it to the national context, to the national realities.
Thank you for talking to us, Dan. Thank you for talking to us, Dan. Thank you.